That's cute.
Fertility Doc's uncensored site on all things fertility doctors around America. Conceive or just planning, you're here to guide you every step.
Hi, everybody. We're coming Fertility Doc's uncensored guest today with us. She has a doctorate in Vanderbilt University Medical Center in the reproductive aspect. Today, she's going to talk to us about coping with infertility this day and age with COVID. You from Texas, Dr. Susan Hudson is Fertility Center.
Hello.
Carrie Bedient from the Fertility Center.
Hello.
And I'm the center here in Nashville, Tennessee. So today, we're beginning to talk with her early. Jumped up on her talking via Zoom. Pretty yellow cat walking on the back. That happens to many. How about you guys? Do you guys interrupt your day Zoom?
So I have a little dog named Gigi, and she was without a doubt and still oldest, and she living her best life right now. Everybody at home, taking her out on walks, and she wants us to do feeding with him, but I don't think she knows what to do. So she'll just randomly start, beats for to have barking in the background, then kill because I worry about, is in psychological damage on my patient around. The first child in my house, she really wants it.
We've got a miniature snitch, and she too is love and attention of everybody. But I get a little worn out. I might get home, and it's like I've done everything in a whole day. Do you think pets across are enjoying people?
Well, I had this topic right before the podcast about it, but our church has a church. And so together, before I went into watched it separately, I was supposed to start his sermon, pictures from different parishioners sitting together watching it. So I always knew that all dogs, apparently now all looking, and unbeknownst, a picture of our cat, and the Bible was right next to the cat, and there was our cat. It's Chelsea. So we go to a church of about 3,000. The cat was up on the screen. So we day.
How many cats do you have?
I have 3 cats. Been interesting doing all 3. So,
do you in that little glimpse of normal life?
Absolutely, it's definitely presented a new, and just seeing animals, a lot of comfort for them.
What do you think has been the biggest that you've been doing a lot of telemedicine? Spent the majority of your time?
I found, aside from going through of a diagnosis and treatment, that was its own kind of is this crisis that is. And the compounded stress we're experiencing of, is there ever going to be get pregnant or to build ways at this point? A lot with basic, simplistic, not different steps, and take note of basis to really keep them.
And what are some of those things that you've talked?
So one of the things that is so much anxiety associated, and with COVID, a higher level in order to with the stress that many people are going to and watching the news.
I'm not a professional in this thing to do. The second day of quarantine, it was only imagine with the stress of.
Yeah, and with people about settings, and not more obsessive thinking, ruminating thinking, population. Help people do have control over how much TV they watch to put their focus on, rather than spending hours, especially for bed, looking to replace that meditation or mindfulness, journaling to do with practicing, set the focus away from the world right now.
People are responsive to doing that, or do you find they're more a train wreck as it happens, unable to turn away? And while it is definitely a look at your news feed or what built into our daily life, spending a lot of time online ever done, you start to able to really, or do they kind of get blown in strange ways because feed while they're typing out a work, or kind of, I should be in an office filled with 20 instead I'm at home sitting by myself?
It's with myself. World I am working right now environment, and it's away from is going on in our outside. One of the things just into a different on with what you're talking about, importance of really making a plan with bed at the same time every night, getting up at the same routine that I have always done in our going about our, but then ending our work, whether it's 5 o'clock to end at, and then and schedule evening. But I think see that even with my daughter, Evan, and her school is fully, and just having, which puts of having structure. Something that we can control. This environment right now, we're control teams and making a plan is
one thing. Often struggle with isolation. And ones who aren't able to have children, other people don't understand. By the world we're in.
Well, it's that people are going to studying, and you guys can and cycle into, and even with going on that I work with from who are between options when there is anxiety go up. This circumstance that we're increasable because they're ending in sight, which really putting effects on hold.
Michele, one of the techniques is mindfulness. Can you a little bit about what that is? And because I think some people understand and mindfulness to be really helpful for how that works.
It's really a practice, learning to stay in the, and there are some there that we could to really help people who don't know how to moment, how to really get grounded with that. But are readily accessible, teaching. So mindfulness can simple being around the room, picking out 5 discs inside your, so that would be a idea of keeping you in the moment. It could be taking orange, touching it and healing it, kind of layer a practice that's centered, is simplistic.
We'll get those set thoughts because I think repress those. So you don't try and do that. You try and just keep on thinking about others.
Let it flow through. So that, and we can way to manage thinking, which and how to manage negative.
And what's one useful?
Well, about mindfulness is mindful about what, so depending on what from, but thoughts can really, and that I do with the patients that I work, even make out a little 8 feelings, and then sitting in a space of quiet, to get into feeling right. I relate that thought. Certain ways, one is so good, and with her when sadness that I'm having, right, do that. So just stop and reflect on what am I thinking? Is this specific stress right now? The answer is yes. Ways that we can course in, which is why counseling can help reframe and frame those thoughts at home, and being is of what are specific to distract myself. And it could be the Ferticom app. We can talk about that. 500 different cope exercises that are fertility journey into the app and doing or station exercise. When that feeling comes up, thought is you could restructure techniques on that right into a way to bring.
I think it sounds very something that they can actually, because as healthcare providers, it's don't just stand there, do something. And fullness, it's don't just do something. And so really having something to help you is really, even in the midst of this umpteen years of, how to get through crises. I even find that it takes me anything done right now, going on about 4 different levels. Kids okay? Is my husband okay? Enough okay? And getting that down at any given, challenging, and hearing, you should mindfulness or breath techniques or things like that. Having my hands and my brain here, because just about 2 breaths and then I'm off.
And, male and female listeners, do you see dealing with fertility in different ways?
Say that I have seen partners or any husbands who are teletherapy that may not be, or the other, or in a therapy practice, women as opposed to men. Fertility journeys experience for men and for women, just as a whole tool that could be valued, kind of address what is apps that were two psychologists, and they are promoting that by they're good tools. Ferticom for women, for men. Two different towards and how it's the so differently
differ.
As the big the differ is by and how things are calm, which is for women, petals to a flower. So you click on flower and it's a scenario, and then you click on that, it opens up again, and then you can click on it. Kind of the way they structured the different colors to our leaves. Click, and they just open.
It's much more direct.
Much more direct, absolutely.
I think we see that in our practice.
Absolutely.
Cope differently. What are some ways that communicate better during their fertility? We see very questions from men, and I know that's a big generalization. Bits can you give us?
Well, so very different. In my 12 plus years of is women thinking about this day, sleeping or actively or something that is totally, and it's very male at it once a day or not quite often, every day, every minute about this, and it's on my mind. Husband will look at a wife, sense of kind of confusion. I only like once a week. We're differently, and couples, the experience of women, the amount of energy that's invested is very different. And what I have couples do is because the wife, for instance, or they need to talk about things, that there are 5 minutes in the evening that are dedicated to talking about the fertility outside of those parts not discussed, which can be very challenging, beneficial for. So
we have really appreciated this test and wisdom. I know our patients are going to really what they've learned today. Sign off for today. Hudson from Texas Fertility.
See y'all soon.
Fertility Center of Las Vegas.
Stay safe.
Eblen, Nashville Fertility.
Thank you so much.
See y'all soon.